Morning, good afternoon, wherever you are. Can everybody hear me? Hi, I'm Jenny Mullins. I use she, her, hers pronouns, and it's an honor to be presenting to you today on the work that we have done here in Pima County to address the COVID-19 pandemic, and through partnerships and collaboration with our disability community-based organisations and our tribal partners. I am going to share my screen. And if you haven't noticed, I have an accent. So I'm originally from Melbourne, Australia, and I've been living here in Tucson, Arizona for the good part of about 30 years, on and off. And I've just come home from a visit to Australia. So if anyone has any difficulty understanding any of the words, because my accent has actually thickened since I've come back, but feel free to put your hand up and ask for some clarification or for me to repeat anything. I will share my screen so you can follow along with the presentation. Sorry. Sorry, folks. I'm just needing to make sure that I can pull it up. I tested it out and I am not sure why it is not displaying. Here we go. Okay. Can everybody see that, hopefully? Okay, so this is a presentation on centering disability during the COVID-19 pandemic through public health, community and tribal partnerships. I too would like to acknowledge and pay respect to First Nations people on whose lands we meet today and their elders past and present. In Tucson, Arizona, as Lizzie mentioned, and in Pima County, we meet on the lands of the Tohono O'odham Nation and the Pasquayaqui tribe. We hope that by the end of the session today, you will have a really good idea of how local public health agencies and community-based and tribal organisations have worked together to address the needs of people with disabilities in Pima County during the pandemic. We also hope that you'll be able to share strategies on ways to centre disability through policies, practices, programs, workforce development, advocacy and collaboration, and also to apply some of the lessons learned that we share and adapt to relevant strategies post-pandemic, and as you in your communities build resilience in historically underserved communities. So I'm sure all of you are aware of the disproportionate impacts that COVID had on certain populations, those that are historically underserved and with medically and socially vulnerable communities. And this was definitely true across the country for people with disabilities. We know that it increased their risk for severe COVID outcomes, such as hospitalisations, unfortunately, very sadly, more deaths in our communities, and social isolation and mental health impacts. We also know that vaccines were not as effective for people with weakened immune systems, and there were numerous barriers for people with disabilities to access vaccine testing and other services, as well as being able to engage in accessible public health information and communications. We're also aware that due to several different reasons, there was a higher degree of vaccine hesitancy in communities of people with disabilities because they had concerns about a number of issues and because of historical mistrust of governmental organisations and medical interventions. And we're also aware that across the United States that the COVID pandemic also created a mass disabling event that has been unprecedented. So the pandemic response for people with disabilities, I think it would be fair to say that across the public health system, which includes federal, state and local response agencies, that we were ill prepared to meet the needs of people with disabilities. We saw, and we were ill prepared in a number of ways to address the pandemic of this nature and of this proportion and duration. So we experienced limitations in data collection specific to people with disabilities. We saw at times lack of community engagement, underprepared workforce knowledge and skills, and lack of inclusive practices in the development of policies, plans, communications, and services. What we do know in Pima County is that without the disability advocacy efforts from the network of disability organisations here in Pima County and in Arizona, we wouldn't have been able to be as effective as we were. I should start by saying up front that Pima County has one of the highest vaccination rates for populations that have the degree of social vulnerability that we have here in Pima County. In Arizona, the COVID-19 was the leading cause of death in 2021. And in Pima County, it was the third leading cause of death. So I think that speaks to the efforts that we went to at the Pima County Health Department and across the county to ensure that those who were the most vulnerable had the services they need. I worked at the Pima County Health Department for the last 2.5 years, working with the team on responding to the pandemic. And for the year prior, the first year of the pandemic, I was working in Melbourne, Australia at the State Health Department there. I was working in their Aboriginal strategy branch. And when the pandemic hit in Australia in March of 2020, I was deployed to the disability branch of the State Health Department and worked with a team to centre disability for Aboriginal Victorians. So I had the privilege of supporting the response efforts both in Australia and here in Pima County. We know that the issue of ableism, which is the devaluing of lives of chronically ill, disabled and immunocompromised people, is pervasive in public health. It is a systematic problem. This is quotes from Matthew Cortland in his interview with the CDC director, Dr. Walensky at the time. And he shared this with the CDC director. It is a pervasive policy, substantive problem that disabled, chronically ill and immunocompromised people, literally tens of millions of us, are not being considered in the technical guidance that CDC issues are in the distribution plans of HHS. So this is just going back to my earlier point that across the public health system, we know that we were ill prepared to meet the needs of people with disabilities. I'm just going to share a little bit of data quickly from 2021, the American Community Survey. In Arizona, in the state, we have 13% of people identify as having a disability. However, in Pima County, this is 15%. And there are other parts of the state that have significantly higher rates of disability. In La Paz is the highest at almost 25%. We know that it depends on what data source you're using as to what the true rates of people living with disabilities are. This is looking at the same data, just mapping it in terms of prevalence and percentage of people. You can see here, this very bottom county down here along the US-Mexico border. This is Pima County. Some graph showing the different types of functional disabilities across the state in adults, including mobility, cognition, independent living, hearing, vision, and self-care disabilities. And this is an infographic that was developed by the CDC for Arizona, showing the same types of functional disabilities, but also showing that there are significant health disparities that exist for adults with disabilities, or people with disabilities in general. In health disparities where they're more likely to experience depression, a larger amount of people with obesity, who smoke, who have diabetes, and who also have a heart condition. In Pima County, where many of you will know this, we're in southern Arizona, and Tucson is the county seat. It's a very large state, roughly the size of New Hampshire, just over 1 million people, and we share a 125-mile border with Mexico, and we have large rural areas of tribal lands. We share the jurisdiction with 2 tribal nations, the Tohono O'odham Nation and the Pasquayaqui tribe. And Pima County has a fairly diverse population. It's predominantly white, non-Hispanic, just over 50%. And almost 40% are Hispanic or Latina, and 4% are Native American, 4% are African American, and 3% are Asian. We have an overall social vulnerability index of 0.91, which is very high, and a COVID community vulnerability index of 0.84. Roughly 40% of our population has high or very high vulnerability to COVID-19. We also have an aging population with 1 in 5 people over the age of 65. And we have a lot of winter residents in southern Arizona due to the beautiful weather we have here. And we see higher poverty rates than the state average, where 1 in 5 residents in Pima County live below the federal poverty level, and that's 1 in 4 children. We are lucky to have more than 12,000 resettled refugee immigrants and migrants in our county. And unfortunately, we also have a higher proportion of unhoused residents than the rest of the state. Our disability profile, and sorry if you can't read the infographic, but it shows that Pima County has higher rates of people with disabilities between the ages of 18 and 64 years. and also higher rates of people with disabilities living in poverty, and children with disabilities under 18 years of age compared to the state and national data. Hopefully you'll be able to look at this in more carefully when the team sends out the slides. So ways that we do assess impacts on the populations and people with disabilities through COVID was we made an effort to really look at the health variables across the social determinants of health. So not just your traditional indicators like how many people are insured, for example, but also the social determinants of health, how many people have access to transportation or live in areas where they're medically underserved, for example. And I mentioned that we have very high social vulnerability and COVID community vulnerability indices, but we did use these indexes to guide our efforts, and we gather data from across settings. We captured data from long-term care, the long-term care system and other congregate settings to help us determine what we needed to do in our COVID response. Of course, we need to gather qualitative data from people living with disabilities, their family members and carers, and other advocates, and wherever possible, emphasize people with lived experience and elevate their voices. And this can be also effective hearing and learning from the coalitions, task forces, advisory groups and commissions that serve people with disabilities. Another way that we use to guide our response is that the mission of public health is to prioritise people who are most at risk in our communities, who are underserved, and these are outlined in the public health ethical principles that we follow. I've put a link to the Public Health Code of Ethics that basically reinforces what I've just said, that it is the mission to ensure that people most affected by interventions are included in the decision-making process and the design of such interventions, but also that we are guided by values and ethical principles, especially around equitable access and distribution of resources. So some of the ways that local health departments and state and federal organisations as well can advance health equity to all types of people experiencing vulnerabilities, but in particular people with disabilities, is to focus on improving access to health and human services, strengthening workforce capabilities. I'll go into examples of this as we move along. Improving data quality to ensure that we are using data to inform our decision making. And of course, inclusion of people with lived experience in public health responses, honouring the nothing about us without us. And this including people in the design and evaluation of public health programs and services, and also in the preparation and engagement for emergencies. One of the things that was very helpful in Pima County is that we had a supportive and committed Board of Supervisors and Board of Health that prioritised equity and addressing the disparities that existed in Pima County pre-pandemic. We had persistent health disparities across various populations, And this translated into disproportionately high impacts of COVID on these communities. The Pima County Board of Supervisors in December of 2020 passed a resolution declaring racial and health inequities and income inequality in Pima County to be a public health crisis. This policy platform created the authorising environment for Pima County Health Department and our other partner agencies to use an equity lens in all response efforts. And this allowed the Pima County Health Department to centre equity in all of its response plans, including the Accelerated Immunisation Plan and Vaccination Prioritisation Plan, and another plan titled Promoting Vaccine Equity for Vulnerable Populations in Pima County. We also, the Health Department, stood up an Office of Health Equity program to guide the department's response efforts and to build our capacity and workforce skills in centering equity. The department was able to develop dashboards based on social vulnerability and COVID community vulnerability indexes at the census tract and the zip code level, and other jurisdictions as well. The Board of Supervisor jurisdiction and also the school district jurisdiction. So our director and our Board of Health and leadership team were very committed about delivering a data-informed response. We also used multi-point dispensing strategies to remove barriers. This meant that we targeted communities with high COVID vulnerability and provided clinics and mobile outreach pods, points of dispensing vaccine, in convenient locations, and using culturally and linguistically appropriate resources. We did this through working closely with community health workers, expanding our community health workforce, and our community health representative workforce on tribal nations. We built our community partners. We worked with our community partners to deliver vaccine clinics and testing clinics at events that they were already hosting. And we utilised community champions as well as canvassers, staff, and an amazing volunteer network. We also created, at the end of 2020, the first Pima County Health Department Public Health Ethics Committee. I want to just say hi to Mr. Charles Jeffrion, who's on the webinar today with us, and he is one of our members of the Board of Health and also a member of our Public Health Ethics Committee, who helped to guide our response to ensure that it was following public health ethical principles. And we also established a very broad cross-sector community advisory committee to inform our responses in underserved communities and find those pathways and local leaders to build trust within the communities that were very mistrustful of government programs. One thing that we were also able to do is formalise our agreements, our collaborative partnerships through agreements with the tribes, with our 2 tribes, and with the Tucson Indian Center via a memorandum of understanding. There were intergovernmental agreements established with both tribes. Other ways that we advance tribal self-determination in our response efforts, and I should acknowledge that there are higher rates of disability within our native populations here in Pima County, higher rates of chronic disease and people living with disabilities. So it was very important that we centred equitable response to our tribal communities. One of the things that we did early on, and this was also one of the things that our ethics committee advanced, was that we were able to recognise traditional healers as part of the healthcare team. If you remember, the first group of people that were eligible for the COVID vaccine when it was first rolled out, there was limited supply. So we really needed to look at who is most urgently needing to get the vaccine. And this included, there was guidance issued by the CDC and various vaccine advisory councils. And at the local level, we were able to tailor some of this in our vaccine rollout plan. So we included traditional healers and other members of clergy ministering to the sick and dying as part of the early healthcare team. We also reduced the age for Native American elders to 55 and over, which is commonly used in tribal communities. So for Native American people who were 55 and over, they were included in the initial rollout, and the rest of the community, it was for 65 and over. As I said, we work closely with the Tucson Indian Center and our tribes, local tribes, to assist with their response for testing and vaccine outreach. And we did so through partnerships and shared resources, both contract providers, vaccine providers, and also our own staff who supported efforts in the rural and remote areas of the tribal nations. We were also able to secure some financial incentives and in the form of gift cards that we were able to distribute not only to tribal members, but other community members in areas where there was high COVID community impacts. Other ways that we worked with our tribal communities was through weekly planning and coordination meetings between the Pima County Health Department, the Tucson Indian Center, and Partners in Health. Partners in Health is an international public health organisation that is focused on improving access to healthcare, and we were fortunate enough to have a local domestic team embedded at the Pima County Health Department to support our initiatives. And we also had a tribal liaison working with the tribe's emergency management teams that also met on a weekly basis and shared resources, information, and coordination of emergency response efforts. It included coordination of vaccine and testing events. We had a weekly COVID-19 clinic in partnership with the Tucson Indian Center. And this led to the development of their new primary care clinic, the Rodney Polimo Senior Clinic at the Tucson Indian Center, which they have just launched. If anyone's interested in looking on their website and looking at their new primary care clinic in downtown Tucson. It sprang from the COVID clinic that was established there early on in COVID. We shared a lot of training and provided technical assistance, and this was two-way. It was two-way training and technical assistance, where Tucson Indian Center was very helpful in the health department improving its understanding and knowledge of the needs of the community. We shared communication such as flyers, social media posts, and website posts. And we also shared a lot of shared the distribution of testing resources and other wraparound information. We jointly developed guidelines for using incentives. Some of you may know that it's very difficult to use federal funding for use of incentives, but we were able to develop policy that was approved by the federal agency that funded these. And the Pima County Health Department was able to support the events that the Tucson Indian Center and other tribes led with the elders and the powwow, and to support providing guidance on mitigation at those community events. As I mentioned, we stood up an ethics committee as well as a community advisory committee. Initially, we didn't have representation on the ethics committee. All the local health departments received a letter from the Arizona Developmental Disabilities Network early on in the pandemic, I would say probably December of 2020. And this went out to all the local health department directors, where they were advocating for improved response for people with disabilities. And this led us to look at our vaccine prioritisation plan, to really focus on ethical and equitable distribution. We were able to push out mini grants to organisations that serve people with disabilities to improve access and communication. And we also established an access and functional needs committee to advise on these activities. That was under our public health emergency preparedness team. So advocacy and action, some examples of what happened here in Pima County. Our local disability organisations led listening sessions across the disability community to seek guidance on vaccine prioritisation and also other issues that were impacting the disability community, and how Pima County Health Department can tailor its responses. As a result of this, like I mentioned, the Ethics Committee recommended revisions to the vaccination criteria and changes to the language that was appropriate to the disability community. We were able to prioritise people with disabilities who were at higher risk and those with chronic medical conditions. So we elevated this group in those eligible for the early vaccines. Also, as I mentioned, like in the rollout of the vaccination across the country and also in Pima County, we had guidelines for the phases of phase 1A, B, C, who needed to go first to be protected by the vaccine. And we were able to change the recommendations. If you remember early on, people living in nursing homes, skilled nursing facilities, long-term care, assisted living were one of the high-risk groups that was recommended for early vaccine. But we, in Pima County, given our diverse communities, large Hispanic and Native American and African American population, we recognise that many families prefer to keep their loved ones at home in the community and provide long-term care support and services. So we were actually able to expand people not just in skilled nursing facilities and assisted living, but those receiving long-term care in the community. You can take a look at this. This is just a snapshot of the plan itself, and it shows the principles, the guiding principles for ethical vaccine allocation. And this was the language change that we used for long-term care residents. So that was definitely something that the advocacy organisations and the disability community was very helpful in helping us tailor the language and elevating the stage at which people with disabilities could receive the vaccine. We also did dedicated events for people with disabilities and conducted audits of the various clinics and pods to make sure that they were accessible and ADA compliant. So some of the mobile vaccination sites that were dedicated to the disability community, and of course all pods needed to meet those requirements, but we also did dedicated clinics, vaccine clinics and testing clinics with various organisations, including SAVI, Southern Arizona Services for the Blind, the University of Arizona Disability Resource Centre, Direct Advocacy and Resource Centre, the Southern Arizona Adaptive Sports, again at the U of A, and through supported housing and within communities with high SVI and COVID community vulnerability indices. Like I said earlier, we partnered with tribes in the Tucson Indian Center to do mobile pods at gathering sites that were convenient and trusted by community members. And we stood up a helpline. There were a lot of challenges initially with having internet-based applications and forms for vaccine. So early on, we established a helpline that people could call, and our Pima County librarians and Pima County Health Department staff staffed that helpline and would help people register for the vaccine. We also developed an at-home vaccination plan and assisted with registration. And this was particularly important for people who were unable to leave their home. And we had our public health nurses and contract vaccination providers deliver the vaccine at people's home if they were eligible for that. We also conducted an outreach project with the Arizona's Medicaid program, the Arizona Healthcare Cost Containment System, ACCESS, and with the OLTEX, Arizona Long-Term Care Services for residents in assisted living and subsidised housing. So Pima County Health Department partnered with these entities to quickly reach the residents that were receiving services through these federal programs. And we were also able, this was something Partners in Health assisted us with, was to provide free rideshare to and from pods through Uber and Lyft. We were one of the communities that Uber and Lyft chose to pilot that. So moving along, some of the lessons learned, as you can hear, that we really needed not only to be better prepared, but to have better engagement systems in place in order to have input from people living with disabilities and a better response, an earlier response and an ongoing response. We learned the value of having strong partnerships with our advocacy organisations, disability organisations serving people with disabilities. We realised that the collaboration with our tribal partners was critical to reach tribal members and deliver culturally appropriate responses, and that we were always in a support role to the tribes and to the Tucson Indian Centre, recognising tribal sovereignty. We learned that we need to enable opportunities for dialogue and equal voices, and we did this through the Ethics Committee, the Community Advisory Committee, the Access and Functional Needs Advisory Committee, and various conferences that we held, one in particular on autism during the pandemic. And we really worked hard to improve our staff's knowledge and to provide access to accessible information. We really worked on with partners to develop assistive communications, and we provided various trainings to all of the pod staff on assistive communications. And we, as I said, conducted dedicated mobile clinics, provided at-home vaccinations for homebound people, and we were able to share some of the grant funding that we received to advance health equity and push out mini grants to our community partner organisations to reach people with disabilities. These were some of the keys to success. The leadership of not only the county and our Board of Health and Board of Supervisors, but our leadership team, the county administrators really had that North Star looking to always do the right thing, and there was a commitment to equity in policy and plans. We worked very hard to remove barriers to access to vaccine-related resources and provided wraparound resources and really built our community health workforce to go out into communities and meet people where they were at. We were also able to offer incentives that really help people that were struggling through the pandemic due to loss of work or other issues. We removed barriers for people getting to the vaccine sites. We worked hard on building trust and quickly addressing any issues that came up or concerns. And we focused on the strengths and assets of our partners so that we could leverage resources across the communities we serve. As I mentioned, we formalised partnerships through intergovernmental agreements and memorandum of understanding. And we also were receptive to advocacy from the disability organisations, but we also our leadership advocated numerous times for more equitable response at the state and federal levels. We were fortunate enough to have enough trust where there was data sharing agreements between our entities, and we were always respectful of tribal data sovereignty, masking tribal data unless given permission to share it, and spent a lot of time and effort on developing our workforce and building our capacity within the agency. So all of the actions were done through an equity and ethical lens. these were some of the examples of how we built capacity, establishing an Office of Health Equity, training staff and volunteers in assistive communications, addressing the ongoing needs of people with disabilities through all of the plans and playbooks and standard operating procedures that were developed. We established the Access and Functional Needs Advisory Committee to guide the response, and funded community champions in disability communities through mini grants. I think I've mentioned most of these ways that we built capacity. And the next few slides are resources that you might like to look at or use. This one is from the Administration for Community Living, which outlines their guidance on how to make vaccination sites accessible for people with disabilities and older adults. These were the assistive communication tools that the Arizona Commission for the Deaf and Hard of Hearing developed, and that Pima County Health Department adopted at our pods. And more CDC resources for people with disabilities, plain language resources and links that you can use if you would like to. And with that, I wanted to leave the next 10 minutes or so for any questions or comments, and just end by acknowledging that there were many heroes in the pandemic response, the healthcare workforce, the public health workforce, but also people caring for people with disabilities, members of the community that advocated for people with disabilities, and we honour the lives of people that we lost through the pandemic. And with that, I will stop sharing and open it up to questions.
Jenny, thank you so much. This has been an amazing presentation, very insightful. We do have a question in the chat, which I'm not sure if it's been addressed yet. Gail said, could you provide the name again of the new health center with the Pima Tucson Indian Center after the talk?
Absolutely. The Rodney Palemo Senior Clinic. It's after a board member of the Tucson Indian Center board who was one of the people that we lost during the pandemic, sadly. And they've named the primary care clinic after Mr. Palemo. Any other questions?
While we're waiting for other questions to come in, and as a reminder, you can ask your questions in the chat, or since we have a small group today, you could even just feel free to come right off mute and ask if you do have a question. We had one other question direct message to me, Jenny, and let me grab it. You may have already addressed this in your lessons learned and when you spoke a little bit about building capacity. But someone was wondering if there is another pandemic in the future, what might you and the team do differently to better support tribal members?
It's a really great question. I think we have reached out to our tribal partners to ask them what we could have done differently and better. And I do think that there's probably a need for earlier engagement with the tribes, and we have since at the Pima County Health Department, they have since established quarterly meetings with our tribal partners and frequent meetings between the directors to make sure that we are addressing their data needs and listening to what their community needs and where they need the pods to be located. Initially, there was a need to get the vaccination out quickly and get as many people as possible vaccinated as quickly as possible. So the department set a very ambitious goal and surpassed it, but it meant that we were spread really thin with our resources, and some of the pods were in not in areas of town that had high numbers of Native American members. But we did compensate for that by offering smaller pods and at schools, tribal schools. I think really what would we do differently is engage earlier and build trust earlier as well to ensure that the tribes led their own pandemic response and did an amazing job here in Pima County, both as well as the Tucson Indian Center, but just being available to the tribes with the resources that they need when they need it. Hope that answers the question.
Yes, and we do have a question from Michael in the chat. Michael says, excellent work. Thank you for sharing. How are emerging COVID variants being addressed?
Well, I think that's really the biggest question on everybody's mind. And as I said, I just came back from Australia where it's winter, and was visiting my mum in the nursing home where she is. And they had a COVID outbreak in her nursing home. Thankfully, she did not get it, but there were about 20 residents that had COVID, and there were some that succumbed to COVID, and they're all vaccinated. So I think that's really a question for the Pima County Health Department, how they're preparing for the variants. And I have taken a bit of a hiatus from the health department. I'm working as a public health consultant currently, working on a contract with one of the tribes on looking at the response to the COVID response for the elders on the nation. I think that everybody needs to know that COVID is with us still, and it's still a threat to people who are medically and socially vulnerable. So keep pushing out the message that people need to be up to date with their boosters. That's what I would advise.
Wonderful. It looks like we have a chat from Tess. No questions. I really appreciate the presentation. And I think we all have, Jenny. Thank you. We do have Joshua Drywater on the webinar with us. Joshua Drywater heads up the Sonoran Center's Native initiatives. Joshua, did you have a couple of things that you wanted to close out with?
Sure. Thank you, Jenny, so much for your presentation and your insights. And I really appreciate you joining us today. Our tribal affiliate within the Circle of Indigenous Empowerment, Jimmy Warren, wanted me to kind of give an update of some of the activities that we have coming up in the next couple of weeks. On August 25th, we have a virtual webinar from 10 a.m. to noon that is going to focus on creative employment strategies for tribal members with disabilities. And we'll send that out in the link for anybody who wants to register. Some of the discussions we'll be having, examples of disability-focused services for members that live in the tribal communities, the available services, some of the gaps and resources, and then we'll talk a little bit about pre-ETS programs and transition youth leadership opportunities as well. And then Jimmy also wanted me to mention that we have an in-person Tribal Disability 101 all-day event that will be coming up. We don't have the information to share with that yet, but we will have it out shortly. I do know it's going to be on September 21st. It'll be at the Phoenix Indian School, and it will be in person, an all-day event. So we'll have more information about that to follow. And then lastly, I just wanted to mention, as far as Finds Their Way, kind of the program I'm the program manager of, we plan to start a safe space after school webinar series for transition age youth that will be led by Native transition aged youth. And that webinar series we will push out as well, but we plan to start that on September 6th. And it'll be a bi-weekly presentation where transition age youth have a spot to go to and ask questions and to learn about self-advocacy skills. And I believe that is everything.
Thank you, Joshua. And again, a special thank you to the Arizona Developmental Disabilities Planning Council. This webinar series is made possible through funding and support from the council. Thank you so much, everyone, for joining. If you have a moment and could fill out the evaluation link in the chat, we would greatly appreciate it. Thank you so much. Have a wonderful day.